issues dealing with long-term cancer pain management in cancer survivors really has changed because, first of all, back in the day, a cancer survivor was someone who had beaten their cancer thanks to chemotherapy, radiotherapy, whatever. Now, the new definition of a cancer survivor is that a cancer survivor becomes a cancer survivor the moment they're diagnosed with cancer. So long-term pain management of a cancer survivor means from the moment they're diagnosed until they either die from the cancer or if they have continued pain, which is very common because of chemotherapy treatment, radiotherapy treatment, and surgery. Many of these patients will continue to have pain after the cancer is gone. And the major problem is that a number of these patients are then abandoned. The GPs, they're on significant opiate analgesics, for instance, for cancer-related pain, or, for instance, a chemotherapy-induced painful peripheral neuropathy in the extremities, all four of them. And once the cancer is gone, the oncologist says to the patient, bye, I've done my job. Come back in a year and we'll do a recheck. So many patients are finding that they're essentially abandoned because they're having great difficulty finding a pain specialist or someone to give them their pain medications that they need for the pain that began when they had cancer, when they were treated for the cancer, and is still there after the cancer has been treated and is gone. I think the most important thing to realize is that when treating a disease as complex as cancer, and this holds true for even the less complex diseases, many times, and specifically with cancer, you can't just treat the patient. You have to treat the patient and their family and or the caregiver. In terms of the type of treatment, it's got to be multimodality, okay? Not just opioids. Opioids really should be the third line. You have anticonvulsant therapy that is needed for neuropathic type pain. These patients have visceral pain. These patients have nociceptive pain. That's where your opioids help the most. To use an opioid to treat neuropathic pain, actually what we know is we need to use more opioid for neuropathic pain than we would for instance, osteoarthritis that's severe. So a lot of doctors, even though a patient during their cancer treatment is taking X amount of opioid, cancer is gone now, but they still have the cancer therapy-induced pain, can't find a doctor to treat them.